So I'll just go through very briefly about some things like autoimmune disease. When a patient walks with the autoimmune disease, what are the things? I can always try to come here and so what happens next when he goes into conversion? There's nothing offensive about any other pathies and all that, but most of the doctors, they try to look at the labs, everything looks normal, your CBC looks quite normal, you're all normal. The patient says, I have this problem and all that, and doctor says, why don't you consult a psychiatrist? So this is American Autoimmune Related Disease Association, this one. So for most of the medical graduates, they are not aware about this. There's a minimal learning on these autoimmune diseases. What happens is that it goes to if suppose a person with POTS is postural orthostatic tachycardia, this one. So this guy goes into a cardiologist, he will be treated for that. And there's no correlation between this particular stuff. So this makes the autoimmune disease. It is definitely a bouncer. It's a kind of googling what you normally say. And the challenge is you don't pick up what is silent autoimmunity because patient doesn't complain with symptoms only when then it starts with the thing. So talking about symptoms, it's a vague kind of thing. Someone can present with some joint pain, someone can present with some rash that becomes easy for us trying to look at other things, but somewhere we don't get into all these things. See, what are the clinical red flags? This is not just for this one, but all autoimmune diseases, you can always talk about ulcerative colitis, Meniere's disease, you have got hypothyroid and all that. Mostly all autoimmune diseases, you have the common thing what we have is adverse reactions to food and chemicals, and you have probably you are the number 7th or 8th doctor the person is going through. He or she will be coming to you. You are the 7th down batsman, and all your upper opening pair and middle order collapse. Tarvata you have to Vivek. This guy is somebody is plays about that. So this diagnosis and all that, it's slightly tricky. You need to have a lot of things. I learned about this gluten sensitivity because I started working on something called autism. I never knew what was gluten sensitivity. GFCF died. I was totally, what happens, leaky gut was not at all there in our medical curriculum. And still, Ramesh, you should tell leaky gut when we tell to our doctors there, this is nothing. This is there. You are being sidelined on that. So the basic, this is the other things. The web of autoimmunity is slightly a difficult thing in the sense you need to understand. There are a lot of keywords. You have to understand what is a cryptic antigen. You need to understand immune dysregulation. If I start talking about immune dysregulation, it will take another 1 hour. So just this kind of I know Akshay, you are noting down. Note immune dysregulation, everything will come up and all that. This is really a problem because what happens is that in spite of doing everything, our patients are not getting any help. So we just need to understand what are the things, antibodies, why they are produced more, what is that overactive phagocytic cell, what is the loss of complement function. There are multiple things. I don't want to go deep. We can always make a note of that, or I can always share you this particular things. So what are the fundamental concepts? You have got something like once you look into stages and all that, epigenetics, genetics, and all that. You understand this. What you need to understand autophagy also in autoimmunity. So the target organs are the adenites, thymus, you have got bone marrow, you have got bronchus. So these are the few things, and there is always overlap between this particular stuff. This T cell and B cell is really tough. One of our friend is there. He always tell you read a book and come. Sudha, you can talk about that because you have read this book. So the permeability barriers is a big kind of issue. We talk about permeability barriers. I used to think it is only the intestinal, you get leaky gut and all that, but you get into lung nasopharynx also, what we have seen during this corona, whatever you are inserting, going directly into your brain, blood-brain barrier and all that. So this is the kind of things what I just wanted to show this particular stuff. And the most important thing, I am here because of something called autism. I never thought what autism is, but somewhere there was a divine this one, and my son was given diagnosis in the year 2000. It was a kind of thing, and you can see this guy is sitting here. And what happens later is, as a doctor, we try to tell, oh, it's not possible. But I happened to start working on that, went diligently and worked on some things. And I believe if you are able to teach a mother to give a proper breast milk for 6 months, I think we can reduce the kind of things, and we can reduce the so many adverse things and all that. So these are a few things. Dr. Narasimha Reddy is going to talk about pesticides and fertilizers. These are all the things which are, but thanks to the social media now, that awareness is quite phenomenal. People are really aware. Our patients, they come and ask us what to take, which is organic food and all that. So this integrative medicine, I landed up into something called integrative medicine after meeting people of different things. I started working on something called clinical mental toxicology, and went on to go for a board certification in mental toxicology. And somewhere we yes, it is difficult to get mentors, but now that the numbers are quite good. Dr. Sunita, you remember we did in the same hotel long time, 10 years back. There was a very thin attendance, so not much people were interested in what is integrative medicine. So this is the 5 principles I taught. I have 4 minutes, 2 minutes? Okay. I'm on the dot, don't worry. There are 5 principles of immune deterioration. We are looking at what are the basic things, what is the root cause of this particular thing. Root cause is heavy metal toxicity. I was talking to one of the media person, and she says, yes, there is a problem with that. I must say here that we have such a kind of thing. Media is going to take a challenge. Hyderabad was not this toxic. When we look at the older people, Prasad Garu, you know that this old, this people who had a good health, 30 years back, we don't have this kind of heavy, everyone is diabetic now, everyone is into hypertension, all degenerative diseases are rising. So this is thanks to the water. Now we understand after the 2017 Flint crisis, in Michigan, you had a Flint water crisis. And for Michigan, Flint crisis was basically something like they have changed the water supply. The people in the Michigan city, the municipality, these people thought they are saving some money by changing that particular water supply. And what happened after 2 years, there was an intense and big kind of backlash. They saw the water, what we have seen in Hyderabad changing water. We see in Bangalore also, Dr. Shilpa. This is a universal thing. But I believe a country like US, it took so many years. In 2017, they identified. After that, there were 5 to 8 years. They were able to change that kind of thing. And amazing book by Dr. Mona, who was a pediatrician. You should look into the book. I have the copy. I can share you that particular stuff. Amazing kind of work which was done. They have seen a tremendous increase in ADD, ADHD. All problems are happening. Then they started working at the lead levels, and they said this is because of the water supply which was changed. So I believe in India there are many Flint crisis-like situations, and the policymakers have to take a kind of thing. You and me can't do everything. We cannot change water supply. I can't do every case and all that. So heavy metal toxicity is the biggest kind of thing. Second comes the food allergies. Third one is the parasite and fungal infections, poor diet, nutrition, and dental problems. This is the basis of treatment. Try to work on that. And these autoimmune diseases have risen considerably because of this particular issues. Adjuvants which were used in the vaccine. There is a kind of you can name anything. I had never seen, when we were taught medicine, we had never seen Crohn's disease was. We were taught, okay, Crohn's is there, rheumatoid arthritis. We used to think that this is not for India. Now that every one, well, actually, doctor has come just. So we will, this is called molecular mimicry, so many things and all that, but I'd like to keep up to that because I don't want to eat on the other person's this one. Aluminum adjuvants in the vaccine is a must. It is being added to increase the B cell production. So, and with this one, this is a big issue which is happening. So this is how, and when we give a combination vaccines, you get into a problem. So big issues. I can just give a simple idea. What is autoimmunity? Autoimmunity is like something like we have a skin barrier, we have a mucous membrane barrier, you have an intestinal barrier. So what is happening if it is breached? So some injection. Welcome, doc. Please come. Join the thing. So we have something like from the skin barrier. If I am giving some injection directly into the through the skin into the intramuscular or subcutaneous, why don't you join Dr. Seth? Please share this here. Because I know you have time bound and things and all that. Thanks, Dr. Srinivasuji. Please come. So you are slated next. I definitely would like to welcome Dr. Shailendra Saxena. He is basically came all the way from Lucknow. He is basically now, you are a dean boss. I think he is going to be a dean now. He is a virologist. He has done something like 300 papers and he had 30 books on his name. Dr. Millie, he doesn't take any royalty on the books. His books are sold 35,000 rupees, something like that. You can see all sprinkled and all that. So I think after आते ही मेरा कम हो गया बस ये. I'm not showing my things, but somewhere I believe most of the autoimmune diseases are rising because of this fertilizers, because of this something what we are trying to give chemicals into the body inadvertently or normally. We'll treat the child with hepatitis B vaccine. I still don't understand what is the rationale of giving hepatitis B vaccine at birth, right? I don't, hepatitis B vaccine thing is, it works only for 8 years. After 8 years, again you need to do a booster. You have to follow a booster. So hepatitis B vaccine is given for if you are a doctor or paramedic or you are into some drug abuser, IV drug abuser, or you are into some kind of other work. Then, if I believe my son is not going to be a doctor by 8 years, not going to be an IV user or into this other work, so why should I give it? And by giving at birth, we are jeopardizing the immune system of the kid. So this is one thing I just want to tell, and I can always stop at this. A thing I just want to tell you about this rising incidence of autism. Rising incidence of autism, Dr. Chris Hexley has done a big work, and it was his work on postmortem of 4 kids who died accidentally, of autistic kids, and they did a brain biopsy and checked the kind of aluminum levels in that particular thing. That was alarming. So this is the kind of his work. You can see his on YouTube also, but yeah. So now I believe this is the result. Somehow we are trying to put a wrong seed inside and we get the results and all that. And yes, I have my, maybe I'm too dogmatic about my thinking about autoimmune diseases, but I can tell you most of my autoimmune diseases, when we start doing some detox, when we start removing that aluminum, when we start healing the intestinal permeability, they start getting better. Okay? Manas, you can take up this, Dr. Shailendra. Dr. Shailendra, again, welcome. Yeah, you were late here slightly, and I would like you to take up this one. We are going to. He has many. That's up here already. Yeah. Stage is yours.
Thank you, sir.